Good afternoon. Hi. My name's Judith Bird, and I have the pleasure of working with Mayor David Briley. I'm his health policy advisor, and I have the job here this afternoon to kick us off, and just want to say a big thank you to all of you for coming. It's an exciting event, an exciting announcement, and without any further ado, I'd like to move on with the program. And first off, I would like to introduce Dr. James Hildreth. He really needs no introduction. He's the 12th president and CEO of Meharry Medical College. His research in HIV and AIDS is internationally acclaimed. He's also very well, his work in HIV actually began 2 decades ago, early on in the epidemic, in the early 80s, and he has had NIH and CDC funds to work on that for 2 decades. He's the inventor of 11 patents based on his research. He's very well educated. He has an undergraduate from Harvard University, where he now has a seat on its board of overseers. He was then the very first African-American Rhodes Scholar from his home state of Arkansas, before going on to receive his PhD from Oxford University and his MD from Johns Hopkins. At Johns Hopkins, he was also the very first African-American to earn a full professorship and tenure in the basic sciences. It goes without saying that Dr. Hildreth has received numerous awards for leadership, research, and his dedication to education, to equality, and access to care in the community. I'm very glad to turn the mic over to Dr. Hildreth. Thank you for being here.
Good afternoon, everyone. And thank all of you for being here for this really important announcement today. Tomorrow is World AIDS Day, and it's going to mark 37 years since June 1981, when the first cases of young gay men, turned up with opportunistic infections. We now know that those young men were infected by HIV, and since that time, more than 70 million people around the world have been infected by HIV, and half of those individuals have died. And that makes HIV one of the most significant pandemics in human history. More than 36 million people are still living with HIV, including 1 million people here in the United States. And here in Nashville, while the rates of HIV infections have declined over the last few years, the rate in Nashville is still higher than the state, and it's still higher than the national average. So the other thing to make note of is that there is a significant disparity in HIV infections nationally and here in Nashville as well in terms of African Americans versus whites. So the HIV pandemic is still a global, national, and local problem that demands an orchestrated response across many disciplines and organizations and agencies. The best hope for ending the HIV scourge, there are 2 hopes, really: vaccines and a cure. But unfortunately, those do not appear to be in the offing anytime soon, and they're going to require considerably more research. As an HIV researcher, I'm convinced we will find a solution, but in the meantime, we must take steps to bring this pandemic to an end. Thankfully, because of some brilliant research on the parts of many, many individuals, we have more than 20 drugs available to treat HIV, and when they're used in the appropriate combinations, they do an amazing job of suppressing the virus. We also know that individuals who are infected with HIV who are effectively treated do not pass their virus on to their sex partners. Furthermore, those individuals who are at risk of HIV, when given a combination of these drugs, will also dramatically lower their risk of acquiring HIV. And these effects of the drugs have given us an approach to ending the HIV pandemic. So a few years ago, the United Nations Joint Program on AIDS announced the 90-90-90 approach. What this means is we want 90% of those individuals who are infected to be aware of their status. We want 90% of those individuals to be in treatment. We want 90% of the treated individuals to achieve viral suppression. And if this is achieved, the modeling shows us that we can actually end the HIV pandemic. This approach is now being implemented in countries and communities around the world. It is the basis for the national ending the epidemic movement in the United States, which started several years ago in New York City. In May of 2017, a meeting was convened in Atlanta, Georgia, by the Treatment Action Group and the Southern AIDS Coalition and leaders of several jurisdictions in the South about launching the ETE program here in the South. As a result of that meeting and some further discussions, several jurisdictions were identified that would be subject to the ETE efforts, ending the epidemic efforts. Those include Nashville, Jackson, Mississippi, and the states of Alabama and Louisiana. In the summer of 2017, backed by community support, Mayor David Briley made the commitment to support the development of an ETE plan for Nashville, and we're very grateful to the mayor for his support for doing so. Then on World AIDS Day last year, and ending the pandemic summit was held at Meharry Medical College, and thankfully that meeting included 120 individuals from a broad range of stakeholder groups to meet and discuss ending the epidemic here in Nashville. The community established some guiding principles that are very important for you to understand and know. These guiding principles have informed the work of the group from start to finish. These are commitment to health equity, social justice, data-driven decisions, determining assets and strengths, and racial inclusion. In April of 2018, the mayor appointed the Ending the Epidemic Task Force for Nashville to serve as an advisory role to oversee the process. I was honored when the mayor asked me to serve as chair. The task force has established 6 major goals for the 5-year plan for Nashville. They include ensuring that 90% of Nashvillians who live with HIV know their status, decreasing by 2/3 the number of newly infected individuals in Nashville, linking 90% of newly infected persons to care within 1 month of diagnosis, and this is critical to success, engaging 90% of people diagnosed with HIV to HIV care, ensuring that 90% of people who are in care achieve virus suppression, and last but most importantly, very importantly, eliminating disparities in HIV outcomes. To achieve these goals, there were 6 action committees that were assembled, including 140 individuals from around the communities representing multiple disciplines and fields of expertise. These committees were access to treatment and care, community education and stigma, data, policy, prevention, and social determinants of health. The committees met several times between June and October to develop the recommendations that are found in the draft report. The diversity of the people on these committees was instrumental to making sure that the plan was appropriate for Nashville and Davidson County. And very importantly, many individuals living with HIV served on these committees. The success of the process can also be attributed to a highly effective coordinating committee. This committee facilitated and integrated the work of the committees and created an environment that was very supportive of meaningful engagement by the committee members. We are really excited to unveil this draft plan today to all of you and to invite community comments. The comments will be collected and will inform finalizing the plan, which will happen over the next several weeks and will be approved in its final form in late January or February by the task force. I would now like to acknowledge and thank those involved in developing this plan. First and foremost, I want to thank all members of the Nashville community, especially those individuals living with HIV who engaged in the process. So many members of the community served on action committees, provided invaluable input, helped us establish the guiding principles, and clearly without community involvement, this plan could not have been generated. And it is a community plan, owned and empowered by the community. So I would like to take just a few minutes to acknowledge and thank the members of the task force for the time and attention they devoted to this process. And they include Dr. Stephanie Bailey, who is the Associate Dean for Public Health at Meharry Medical College, John Ray Clemens, who's a member of the Tennessee General Assembly, Brian Hale, who's the CEO of Neighborhood Health, Kevin Hartman, who's the owner of Nashville Pharmaceutical Services, Sharon Hurt, Executive Director of Streetworks and a member of the Metro Council, Joseph Interante, Joe Interante, who's CEO of Nashville Cares, Julian Leggs, a community advocate, Michelle Johnson, who's from the Tennessee Justice Center, Dr. Bill Paul, Director of the Metro Health Department, Dr. Stephen Rafanti, who's the Chief Medical Officer for the Vanderbilt Comprehensive Care Center, Reverend Edwin Sanders, who's the Senior Servant at Metropolitan Interdenominational Church, Tom Ward, Executive Director of Oasis Center, and Dr. Carolyn Wester, who is the Director of the HIV/STD program for the Tennessee Department of Health. Would you please join me in acknowledging and thanking them for their work? I also want to thank the members of the coordinating committee without whose efforts this could not have happened. They include Claire Bowles from the Southeast Education and Training Center, Meredith Brantley from the Tennessee Department of Health, Judith Byrd from the Office of the Mayor, Amber Cohn from the Metro Department of Health, Larry Frampton from Nashville Cares, Ebony Gordon from Nashville Cares, Ben Grambling, who was our planning consultant, Jessica Hoke from Nashville Cares, Josh Love from the Public Health Department, Brady Morris from the Nashville Regional HIV Planning Council, Peter Ribeiro from Vanderbilt University, Tariq Smith from Meharry, Reverend Terry Terrell from Metropolitan First Response Center, and of course, Kristen Zach from the Office of the Mayor, who's now with the Department of Health. Kristen, there she is over there. Please join me in acknowledging them. And lastly, I want to just say a genuine thanks to Mayor Briley for his support of developing this plan and also for his commitment to a healthier Nashville. Certainly without his support and his interest in achieving this would not have happened. And on that note, I'm happy to turn the mic over to our mayor, Mayor David Briley.
Well, he stole all my thunder because I did want to thank everybody who has participated in either one of the coordinating committees or on the task force. So let me just say this. As is typical in Nashville, a good thing has come to light not because the mayor thought of it, but because so many people in the community decided to come together and focus on an effort that warrants more effort than virtually any other concern we have in our community right now. I'm old enough to remember when getting focus on this issue required a group like ACT UP to engage in civil disobedience to get our country to focus on the fact that people were dying without explanation and without care. Thankfully, we are far from that day. And today, in a city like Nashville, as a community, we have the opportunity to come together and, in fact, not just in practice, but in theory, in fact, end the epidemic. We owe it in our city to follow through on the efforts of so many who didn't make it to a point where there was a treatment for HIV and AIDS, to the families that were destroyed, to the lives that were lost for decades in our country, in our city, to now where the technology, where the medicine does exist, to follow through and cross over that barrier, cross over that river, and truly end the epidemic of HIV and AIDS in our community. I know that Council Lady Sharon Hurt, who's here with me, shares that strong sense, and she is as committed as I am to making sure that we do that. I know that everyone in this room understands and appreciates the life's work of Joe Interante at Nashville Cares and everything he has done to make this an effort in our community that is actually possible today. I know his tenure at Nashville Cares will someday come to an end. I'm sure he hopes so. But as he moves into a different phase of his life, let us, each and every one of us in this room, make as strong a commitment to ending the epidemic as he has shown in his life working at Nashville Cares over the last decades. Joe, I want to personally thank you for everything you've done in this city to focus us on what is truly something that we should and can do in Nashville. So, Joe, I appreciate everything you've done. Nashville is lucky to have Dr. James Hildreth here in our town as well, not just because of this issue, but because of all the leadership he is demonstrating every day in terms of improving the quality of health of the people in this community. And I want to thank you, Dr. Hildreth, for your commitment to the city of Nashville. So I'm here today essentially to accept the work of the city. This report, even though we're still ready for more community input, is good work. And I can tell you that I'm committed to making sure that as we move forward as a community, we implement the recommendations and that we make the kind of progress that is necessary to end the epidemic in Nashville. That's because it's possible, and it's right, and it is our obligation. Even today, 600 Nashvillians are living amongst us that don't actually understand that they have HIV. That is a step that we can easily, with just a little bit more effort, push through and resolve. Because of medical advances, we now have the ability to push down the transmission level below the level of transmission that took place at the height of the epidemic. And as we are so prosperous in Nashville, we need to do more to reach out to marginalized communities that are at the highest risk of getting transmissions. That's always been the case. It's something we've got to focus on, and it's going to require each and every one of us to do that. So today, I'm here to accept the report, but even before the report is final, I'm calling upon Nashville to make the kind of commitment necessary to end the epidemic in this city through collaboration and community effort. Our door is open. We look forward to talking and making progress with anybody who's got a shoulder to put to the wheel. So again, let me say thank you to each and every person who has participated so far, and we look forward to future collaboration and efforts in this regard in Nashville. I think Dr. Bill Paul is now coming up, so with that, I would like to introduce Dr. Bill Paul, the Director of the Health Department.
Thank you. Good afternoon. Thank you for being here. And as host, I guess I get to welcome you and get to celebrate the fact that some of the greatness that's in this room kind of rubs off on the health department. So we're grateful you're here. Many of you will remember Reverend Bill Barnes. He was a passionate, lifelong advocate for affordable housing, for fixing policies that disadvantage some Nashvillians, create unhealthy concentration of poverty and all that goes with it. I remember one of the first times I met him, I was making an earnest presentation about grocery stores, fruits and vegetables in food deserts. And he raised his hand and he said, "We've been trying to get a grocery store in Edge Hill for 20 years. What's going to be different this time?" And so ever since then, when I'm in a room with a group of people talking about something new, I find myself asking, what's going to be different this time? I want to thank all the people who have worked on this audacious plan to end the epidemic of HIV. The collaborative work just on this plan over the last year by so many passionate people from so many different disciplines, different parts of town, different organizations as a shared community project feels different from business as usual. It's definitely worth celebrating. So thank you. Give yourselves a round of applause for coming up with the plan. The hard work lies ahead, turning this plan into projects, into work, into results, into change. What is going to be different this time? Are we going to get a big new infusion of funding? Are we going to get more attention and higher priority from the Metro Council and the Nashville community? I sure hope so. But I'm also not absolutely sure that that is everything we need to be different this time. I can think of two things that I'm going to talk about, and they were themes at the summit a year ago that carried through. First, all of us need to commit to working together. There are many organizations working specifically on HIV, many more that are helpful to people who are facing HIV, even if HIV is not their main mission. The thing is, there's a lot of improvement in our working together as a seamless, effective community effort. To succeed, we would need to use the principles of collective impact. It starts with a common agenda, and that's what this plan represents. Second, it requires shared measurement systems. And we need to agree on what we're measuring, and looking together at the data across all the participating organizations. Third, mutually reinforcing activities. As we move forward, we need to draw on the strengths of every person and every organization that's engaged. Some of us will need to do new things. Some of us will need to do different things. Fourth, it will require continuous communication in ways that maximize trust and best support the implementation of the plan. Fifth, it will require backbone support, and we will need resources specifically for this plan to hold it all together, and we will have a coordinator for this. If we come together and compete to do battle on behalf of our egos, our organizations, or our boards, things will not be different. If we get impatient with the give and take of collaboration, lose faith and go back to our corners, mistrust will win and things will not be different. If we commit to working together as a community, nothing will stop us. That's the first thing, working together. Second thing, we do need to keep focusing on equity, persistently, consistently. We need to keep paying attention, listening, measuring, keep learning new skills and addressing barriers when we find them. HIV thrives on the margins. And if we're not working to reduce marginalization of people, we're not working to reduce, we probably will not be doing things differently. Some of our organizations might feel like, hey, we got this. And maybe some of us do, but my guess is we all have things to learn and improve on. And at the Health Department, we've launched an effort to operationalize and institutionalize equity in our organization, and for us, it's pretty big. It will take time, but we have to do it. If we really focus on equity to the point of transforming each of our organizations from our boards to our frontline staff, we will absolutely end the epidemic of HIV and start to transform Nashville in the process. So we need to work together. We need to keep our eyes on equity. I'm confident that if we succeed in these two things, we will absolutely, as a community, end the epidemic of HIV. Jonathan Mann was a pioneer in the global effort to fight AIDS. There are two quotes I think resonate with the work ahead for Nashville as we end the HIV epidemic. First, silence, exclusion, and isolation of individuals, groups, or nations creates a danger for us all. Second, people say there's no use trying to change the world. But if we don't try, will it change? That's all I have for you right now. I would like to introduce the Reverend Terry Terrell, Chief Operating Officer of the First Response Center, and she's going to introduce you to the plan.
Good afternoon, everyone. On behalf of the task force, the committee, and our Nashville community, I have the honor of sharing highlights of our process, as well as highlights of the plan, in which each of you will have access to when we're finished. As it was mentioned, we began this process a little over a year ago with a group of community members. We had 14 task force members. We had 14 coordinating committee chairs, but that was just only a tip of the iceberg. We had about another 120 or so individuals that worked with us in each of these committees, the 6 action committees that laid the groundwork for this plan. We had a total of 35 meetings as a group. We had an all committees meeting where we came together and we reported on the work that each of our groups were doing. And then we could not have done this without the support of the Treatment Action Group, Southern AIDS Coalition, or the Care Foundation of America. Those organizations were foundational in assisting other cities in putting plans together, and they were very instrumental in giving us the support that we needed to move our plan forward on such an accelerated rate. Our time frame was pretty ambitious in respects to other cities that began the work of their own plan. Our Ending the Epidemic plan is a 5-year plan, and it's just the beginning. We're not saying that whatever the plan states today is what the plan is going to look like a year from now, 2 years from now, or even 4 years from now. We hope that this is a document that will be a living document, something that will continue to breathe and live as we continue the work, and there's advances in science as well as our ability to do the work within our community. But what we want to do is that we don't want to keep this process in a bubble. We know that there's so many other thoughts and experiences that we need to be able to factor into this process. And so we would like to invite you, the community, and those that you know that would like to participate to give us feedback. We want to hear from you. We want to know what you like about the document. We would like for you to let us know what we missed within the document and who needs to be involved as we move forward. At the end of this presentation, I'm going to show you all how to access a copy of it as well as give us feedback. So why now? Why this time? Why this place? Yes, there has been great advances and progress in the decline of new diagnoses of the disease. However, there are still populations that are disproportionately impacted by HIV and AIDS. And so our work still has ground that we need to cover, and there's plenty work for us to do moving forward. Still being impacted are the same gender-loving males within our community, particularly between young adult ages 18 to 35. This is what this chart shows. There has been progress in those communities of ID drug use as well as heterosexual contact, but those rates are still kind of increasing in certain populations, so our work needs to continue. As Dr. Hildreth mentioned earlier, the Nashville rates for new diagnoses is much higher than the state level as well as the national level. So, what about our goals? When we began this process, Dr. Hildreth sat us down and said, listen, I want you to give us recommendations that will be effective. And of course, there was conversation, well, do we need to think about the budget? He's like, don't think about the budget. Let's just think about the cure. Let's just start there with what our community really needs to put an end to the epidemic. So the work and the ground that we laid out, we were ambitious. We really did think about what would it take to end the epidemic here in Nashville, Tennessee. So, our goal is to ensure that 90% of Nashville residents living with HIV know their status. Decrease by 2/3 the number of Nashville residents with newly acquired HIV. Link 90% of those diagnosed with HIV to care within a month of diagnosis. Engage 90% of people diagnosed with HIV in care. Ensure that 90% of those engaged in care achieve viral suppression, and eliminate disparities in HIV outcomes. Goals will be achieved among all populations. And within this plan, we did take time in care to really look at some of those subpopulations that were most disproportionately impacted by the disease. So how are we going to get there? When you take the opportunity to look at the plan, you can look at how we plan to do this in Chapter 5. get more people tested, use media and social media to increase awareness and engagement, provide comprehensive health, sexual health information to all, take full advantage of medical advances like PrEP and PEP, get the right care to the right people at the right time and place, including medication, strengthen early intervention workforce and peer support networks, maximize maximize capabilities of primary care, address social determinants like housing, transportation, as well as workforce. So what are some of the things that we need to do to move the plan forward? As the mayor mentioned, to create an oversight body that will take ownership of this process. Dr. Paul mentioned the hire of a dedicated Metro Public Health Department staff position. We need to increase and diversify funding sources. We need to be able to identify and partner and have those commitments with those that we can be sustained for the benefit of those that we serve. And to establish a data team. We want to be able to track effectively the work that we're doing to make sure that we're reaching the significant change that we need. So, between now and I believe it's the middle of January, we will open a period for the public to be able to give comments. We invite you to go to the health.nashville.gov website, and I'm going to do a little show and tell here. And it will take you to the health department page. So you have the scrolling piece here. At this point, it's the first bullet that takes you to Nashville HIV Ending the Epidemic Plan. Click there. And here you have two options. You can get a copy of the plan, PDF, in its entirety, as well as leave your feedback. Now, for those of you who like hard copies now, there are coordinating committee members, please identify yourselves, that have some hard copies that are available today. So please see any one of us and we'll be happy to give you what we have. If not, please go to the health.nashville.gov website and please get your copy, and we welcome your feedback on the plan because this is definitely a community effort. Thank you so much for your time. We look forward to your feedback. And now I will turn it over to Joe and Taranti.
Your Honor. I almost said David. No, like, not appropriate in public. I was not expecting that. Thank you. That was extraordinarily kind. And I wasn't going to say this, but I do feel like, in some ways, helping to be part of this plan is part of the legacy that move beyond the walls of the agency that I work with to be part of the engagement of the community as a whole in doing something that is truly remarkable and that will save and transform lives. You know, there's a poster, an old AIDS poster, I think it came from Richmond, Virginia, that basically reminds us, which is a good reminder on World AIDS Day, that every person living with HIV or AIDS is someone's brother, someone's sister, someone's son, someone's daughter, someone's lover, someone's husband, someone's wife. So I just want to say a few things about, you know, there's a lot of numbers in this plan that you'll read, and we will be welcoming some questions just at the end. But just a little bit, you know, as a gay man who's been living with HIV for, I think, 33 years, when I found out, basically they said, you've got it. We don't know how to measure it. We don't know how to track it. We certainly don't have anything to treat it. So good luck. The world is different today. You know, as you've heard, we now have treatments where, and I should also say, and they said, and there's an 80% chance that you'll be dead in a year, because that's what mortality rates were like for the disease back then. That's not true anymore. People now live for decades. People not only live for decades, but can use the tools to eliminate their risk of transmitting the virus to loved ones. And those are the opportunities that have driven this plan and made this plan, possible. I do want to just say that, so with the goals that Terry was talking about, so what does that mean in sort of human terms? And for one thing, I think you need to realize that if we achieve our goal of reducing infections by 2/3, that means that 94 people in Nashville who would otherwise be living with HIV will not be living with HIV. Who will not, and despite anything that people say about how much easier it is to manage a disease, which is true, I think any person living with this disease will remind you that it's still no walk in the park. There are lots of issues and considerations that we all face and that we need to grapple with that are in our mind all the time. And people will be freed. Young folks starting out their lives will be free from those additional burdens as a result of our success in this plan. But there's also a community and public health impact as well, because I know people are interested in that return on investments. So let me also translate that into dollars. The current estimates are that the lifetime cost of caring for a person with HIV, even with new advances, is $360,000. If you multiply that by the 94 people who will no longer be HIV positive, then what it does is this is saving $33,840,000 in healthcare costs of this community. That's a lot of money that can obviously be used and devoted to other issues which are needed. So there are both individual, this is a win-win plan. There are benefits to individuals and there are benefits to the community. I'm just been honored and pleased to be part of it. At this point, while we want you to offer input through the mechanisms that we've set up, we'd be happy to entertain any questions at this point to any of us that you might have about the plan or the process at this point. And these are for reading, so in order to see, I need to take them off. Anybody? Nope. We did such a complete job. Congratulations, folks. Judith? Bring Judith back.
With that, thank you all for being here. We appreciate it. Please do provide your feedback, and thank you very much.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.